So ladies and gentlemen, welcome back to the Health and Wellness Spot. I am Dr. Lewis. Now, we've been having conversations around sugar and about sugar, and I get so many questions that involve the benefits and the effects of sugar on our body organs. So today I've chosen to talk about sugar and the effects that sugar brings to these body organs. Now remember, when I mention sugar, I mean simple carbohydrates. Basically, carbohydrates are what we call sugars, okay? And also, I want you to remember that carbohydrates are the only foods that if you do not eat, there is no deficiency condition, okay? So you will never have a disease as a result of not eating carbohydrates. But all other macronutrients, be it fat, be it proteins, will yield a deficiency condition if you don't consume them, even the vitamins. Now, sugar has effects when you consume it, but when you don't, it doesn't. So that tells you we don't have benefits of consuming sugar. So for those of you who keep asking me that what are the substitutes of sugar, there is none. Okay, you do not need to substitute sugar for any reason whatsoever because it has no benefit or nutritional value to you. So today I'm talking about how bad sugar is to our systems, okay? So that by the end of this video, you will get to understand and relate all the conditions that you've experienced with yourself or even in with your relatives that concern sugar and diabetes. Now, diabetes is basically a sugar condition, basically a chronic condition of high blood sugar levels. Okay, so that means that if you want to handle diabetes, then you'll have to drop the sugar. Okay, so basically you'll have to drop carbohydrates. We will get to that. Now, sugar is very interesting. It's a very interesting molecule. Why? Because this is the only molecule that most humans have decided to protect and blame other molecules like salt and even other foods like meat. So sugar is a culprit in almost every simple condition that you experience, okay? So now, when you take sugar, so we'll start by explaining how sugar affects all the body organs, and then how these conditions like blindness, like kidney failure, they come to occur. And again, the effects that happen after. Like for example, when you fail, when your kidney starts to fail, what are the effects of kidney failure, okay? So now, when you talk about sugar, we want to talk about something called glycation. And what is glycation? Basically, glycation is the amount of sugar that is attached to red blood cells. That is the danger. Now, there is this thing I've written here, sugar plus red blood cells complex. What does it entail? When you eat sugar, and then there is this rise in blood sugar all the time, what happens is sugar attaches to red blood cells. Okay? So once it attaches to red blood cells, we all know if you pour tea on the table that has sugar, after some time it either attracts insects or it gets sticky. The same concept happens here. So you have your blood flowing through blood vessels. So we will take this as our blood vessel. Okay? So this is basically a cut blood vessels, and this is like a transverse. So we've cut it into a half. So this is the inner part of the blood vessel. So blood is flowing through this blood vessel at some pressure, and this is from the heart towards the organs. Okay. So now, sugar forms complexes with the red blood cells, and those complexes are sticky. That means, remember that the blood is flowing swiftly into the blood vessel. Okay? So now, once you form a sticky substance that is sugar plus red blood cell, then that sticky substance sticks on the surface of the blood vessel. Those red blood cells start to stick on the surface of blood vessels. Now, once they stick here, these blood cells that are flowing through, all the blood has cells and nutrients that are flowing through, they encounter this lump or that complex. And then they start attracting other cells. So this is what happens. As blood flows through, it starts to attract other cells on this lump, and the lump keeps on growing. Once the lump keeps on growing, we start getting something called resistance. So the blood that is flowing through this blood vessel start experiencing resistance, okay? So the pressure against the blood that is coming through. Now this pressure, which is exerted on the walls of blood vessel by blood, is what we call the blood pressure. So if at all this wall of the blood vessel starts to thicken because of formation of this, so it starts to thicken, then we have a thick blood vessel, and therefore the diameter of the blood vessel starts to narrow. Once it starts to narrow, you see, so we are having high pressure of blood going through that blood vessel. So there's so much resistance to blood, and therefore this causes a high blood pressure. So that is what we call hypertension. Okay, so hypertension is as a result of this complex of sugar, and this complex of sugar is what we call atherosclerosis. Which basically means that there is thickening of blood vessels as a result of a complex formed on the wall of blood vessels that narrows the diameter of blood vessels by thickening the wall of that blood vessel. Now, misconception number one. Remember, this is sugar causing this. Sometimes you'll hear that thickening of blood vessels will be caused by cholesterol. True. However, what is the type of cholesterol that causes this thickening of blood vessel? That is the bad cholesterol, the low density lipoprotein. And where do we get that bad cholesterol? Is from breakdown of sugar. So this is what happens. CHO is my carbohydrate. So I've eaten my carbohydrate meal. It goes and is absorbed as glucose. Now once you absorb glucose, this glucose goes to the liver. Okay? Then the liver breaks this glucose down to give you ATP. So you get ATP, which is the energy currency. So this is what you require for your cells to function and your muscles to function. Now, the problem is continuous consumption of these simple carbohydrates, the sugars, the fructose, the milk sugar and stuff. Once you continue eating this, you are getting excess of glucose in the liver. So the liver is getting so much glucose and it needs to break it down to give you ATP. However, this ATP is required when you are functioning, maybe when you have physical activities, when you're involved in the gym. So those who work out can tolerate this glucose. However, for most of us, we have sedentary lifestyles. So we work late, we sit in the offices, we take too much carbohydrates and we don't have a channel to get them out of the system. So what happens? Most of this glucose is then converted to fat. And this fat is sent into fat cells. So that is the reason why you start adding weight. And this fat is the one that we refer to as cholesterol. So this is the dangerous cholesterol. The cholesterol that is found in eggs, that is found in meat, fatty meat, and for that and others, does not cause you blockade of blood vessels. The low density lipoprotein that comes from simple carbohydrates is the one that is causing you this. So now, when you go to the hospital and you've taken a cholesterol test and it's high, and then you're told your blood vessels have started narrowing and that's why you have a high blood pressure or you have a risk of stroke, you are given drugs called statins. Now, these statins are basically drugs that lower your cholesterol levels in the system. Now, remember we said in our previous videos that you need cholesterol to survive. So you need cholesterol for formation of cell membranes. All cells in your system have a layer that is covered with cholesterol. So you need that. You also need cholesterol to form hormones that will help you in normal functioning. For example, testosterone for men. So if you lower this cholesterol using these drugs, then you'll experience erectile dysfunction. And that's the reason why one of the side effects of statins or drugs that lower cholesterol, the likes of atorvastatin, simvastatin or rosuvastatin, those three, they're examples of statins. One of their major side effects is erectile dysfunction. So now you know where that comes from. Okay? So now, you do not need to lower this cholesterol in your system unless it's the bad cholesterol, and we will get to know how to lower it. So, you have increased your blood pressure, that is risky. You also keep on consuming simple carbohydrates, and that means you keep on narrowing this blood vessel until the entire blood vessel is occluded. So no blood is going through that blood vessel. Okay? Now remember, this blood vessel is carrying blood cells and oxygen and glucose and immune cells towards tissues. So this blood is supposed to take white blood cells towards tissues that are injured so that you get recovery. It's also supposed to carry nutrients to cells and muscles so that you get to function. Again, it has red blood cells that carries oxygen towards the same muscles and the same tissues for you to function normally. So if you block this blood vessel, be it a larger blood vessel or a smaller blood vessel, that means blood supply towards all the organs in the body will be altered. Now, once you alter the blood supply towards all organs in the body or all tissues, these tissues will experience something called ischemia. So basically, low oxygen and nutrients are flowing to that tissue. That is what we call ischemia. Now, once you get that ischemia, then these tissues start to attract infections. Okay? And when there are tract infections, it is difficult to heal. Why? Because there is no blood going to these tissues. So there are no white blood cells to help you fight that infection. Number two, that foot, let's say it's a foot, there's a blood vessel that supplies the legs. So this blood is not going towards the legs. So the leg is not getting these nutrients and oxygen. So it starts to get ischemia and then necrosis, which basically means rotting. Now, once you get a wound on your leg, this wound attracts bacteria, and then there is no wound healing. Because one, you have excess sugar in the system, which is a rich source of culture for bacterial growth. Number two, the blood vessels towards the leg have been occluded. So there is no blood flow towards that leg. And therefore, it starts to rot. And even though with the injections of antibiotics, they are not even being supplied to the leg because the blood vessels that are supposed to supply that antibiotic to that wound is occluded. So that foot ends up becoming a diabetic foot. And then you get an amputation. Okay, now you're getting an amputation to fix this problem, yet you're still consuming simple carbohydrates. Have you fixed the problem? The answer is no. So basically, that's the reason why people will still go for amputations, even on those people who are on drugs for diabetes, and they will still die. Okay, so now that is the longest channel. Number two, this complex makes the red blood cells very inflexible. The red blood cells are supposed to be very flexible because they need to go through small capillaries and venules to get nutrients where they're supposed to get. Remember, they are biconcave. So a red blood cell looks like this. So it's biconcave, and this is basically to increase the surface area at which the cell carries oxygen. Okay, so this complex, the sugar RBC complex, makes these red blood cells very inflexible, and again it occupies the shape. So basically it makes this cell have a very limited amount to carry or capacity to carry oxygen, and also it's rigid, so it cannot go through blood vessels, and there is the reason why we have this atherosclerosis. So that is just a sneak peek of how sugar starts to affect your organs and your organ systems and even your tissues. Okay, so that is the sugar and red blood cell complex. Now that is the reason why I started with this, is because this is where the problems start. Once you occlude blood vessels and once you break down the nerves because of sugar and to affect all the organs, then you'll have all these problems that are concerning sugar. So let's hold that thought and then go ahead. So you have excess sugar already in your system. That is what we call diabetes, and this diabetes mellitus. So what are the effects of this sugar in the system? Okay, because our reasoning here is we want to clear sugar so that we reverse diabetes, so that all these other body organs start to function. So what are the complications of sugar and diabetes in the system? There are two. One is the macrovascular, the other one is the microvascular. When I say macrovascular, I'm basically saying that sugar causes effects on small. Micro means small. Vascular means vessels. So microvascular is for small blood vessels, the venules, the capillaries that supply tissues. And macrovascular effects are for those larger organs, okay? Or rather, larger blood vessels like the aorta, like the pulmonary arteries. So, on microvascular effects of sugar in the system, there are three. One is neuropathy, two is nephropathy, and three is retinopathy. Good. These are scientific words. I don't want you to cram that. I want you to get the concept. Now, neuropathy, this is neuro, which means nerves. Then pathy means destruction or destroy. So neuropathy means destruction of nerves. And where are nerves coming from? The brain and the spinal cord. So you'll have brain damage. Okay, so that is number one. So here we have the organs that are affected by excess sugar in the system. So we have brain damage as a result of death of brain cells and death of nerves. That is what we call neuropathy. What about nephropathy? Nephro means the functioning cell of the kidney is called the nephron. Okay, so when you say nephropathy, you mean you're destroying cells that are in the kidneys. So number two here is the kidney destruction. So we have brain destruction as number one. And this, before I go even to the kidney, brain destruction and nerve destruction is the reason why diabetic patients experience that numbness in your fingers and your legs. So you will not feel any pain because the nerves that supply, so remember it's neuropathy, you've destroyed nerves. So the nerves that supply the legs and the fingers, they are dead. Also, the nerve that supplies the eyes can die also because of sugar. Once they die, you'll not feel the pain in the legs, and that's why most of the times diabetic patients have a wound in the legs. They don't feel the pain. So there's the one that you'll feel the pain, and there's the one that you'll not feel the pain because of destruction of nerves. Okay? So once you don't feel that pain, your leg keeps on rotting and getting this infection, and you're not feeling the pain, so it gets worse with time. Again, that is for the brain. Okay? So brain and nerves, that's the reason why they get peripheral neuropathy. So peripheral neuropathy is just the numbness and the tingling in their legs and hands. For the kidney, we already said this, nephropathy. So nephron is the functional cell of the kidney. So now when you destroy this unit, then you bring about kidney problems, which is basically AKI, which is acute kidney injury or chronic kidney injury. Now, here is where it gets interesting. When you have acute kidney injury, AKI, this one can be managed. Okay, so basically reduce your blood sugars and stuff, and then your kidneys can reform. Okay, also remember we've blocked blood supply to the kidneys, and therefore we are having all the problems that injure the kidney. Okay, so sugar is the #1 cause of kidney problems. It is on the top of the list, and that's why when I tell you to stop taking sugar, some of you will tell me that at the end of the day we will all die. That is a perfect statement. However, it changes meaning once you get to kidney problems and dialysis, once you get to renal problems and hypertension, once you get to blindness, and once you get to amputation. When now you have the diabetic foot, or you have kidney problems, and you have this blood pressure that cannot be controlled, then you start asking questions again. You now reverse your statement that was saying we will all die anyway. If we don't eat sugar, or if we eat sugar, we will all die. Now you're only looking for life. So you come back asking another question. How can I handle kidney problem? Which drugs should I use? Now, you're failing because using drugs is not the solution. The solution is in what you're eating and your arrogance. So please, sometimes when somebody explains these things to you, take them serious, because once you reach to amputation, then you start appreciating life. And we don't want you to get there. We want you to avoid sugar so that you avoid these problems, okay? Because it's easy, and that's why we bring this information to you. So basically, once you have acute kidney failure, you can help, you can treat it, okay? Now, once you have chronic kidney failure, which is CKD, or chronic kidney disease or chronic kidney failure, this is the time when you start going for those dialysis sessions and your blood pressures are uncontrollable, extremely high. Remember, the kidney has several functions in the body. Function is, #1 is to control blood pressure and also acid balance in the system. So if you have failing kidneys, then your blood pressure will always go up. And this is the time when you're told to stop using salt, because now you cannot excrete it, because remember, kidneys are the organs that help you excrete substances from your body, toxic substances. So basically in your blood, you will have high content of urea and all those protein metabolites in the system. So you'll have problems. You start experiencing psychosis and stuff. And you'll also have a problem in excreting sugar, which means water will be retained and salt will be retained in the blood, and your blood volume will go high. Once your blood volume raises up, that is an increase in blood pressure. We'll talk about blood pressure someday. So once you increase your blood pressure, then you go ahead and start using drugs again. The same drugs that are supposed to be excreted by the kidneys, and yet the kidneys are failing. So you will end up being intoxicated by the side effects of these drugs. Okay? So the basics is just in avoiding sugar, and then your kidneys go back to normal, and then your body resumes normalcy. So that is the kidney. #3 is retinopathy. Retina. Retina is a substance that is found in the eye. So #1, it kills the retina. So you will have blindness. So your eyes will have blindness. Sugar kills the eye. That's why diabetic patients start having blindness. Also, sugar kills the liver, which means the liver is the home that produces vitamin A. So vitamin A is the one that is aiding in vision. So once you kill the liver, then there's no vitamin A production. And again, you've inhibited blood flow to the eye. So even if there is vitamin A, it doesn't reach the eye. So the eye starts to go blind. Why? Because there's no nutrients and nourishment of the eye because of occlusion of blood vessels. There is a failing liver because of sugar, so there is no production of vitamin A. And then you're killing the eye through retinopathy. That gives you blindness. So if you avoid sugar, again, you replenish everything and the eye goes back to normal. For the legs, we've talked about amputation. So in the legs, you block nervous flow to the leg and blood flow to the leg, then you might end up in getting those conditions and amputation. Then the liver, we have a fatty liver. Once you have a fatty liver, you'll experience all symptoms of diabetes, so you'll have problems with hormone production. Remember, the liver is the organ that protects our bodies, so immunity will go down. That's why HIV patients and diabetic patients have low immunity. Number two, the liver produces hormones, the liver produces enzymes, the liver helps you in digestion. So all these functions of the liver, we have a video that talks about functions of the liver, so you can take a look at that. So all these functions of the liver, even detoxification of drugs will be a problem. So you will experience higher side effects of drugs because the liver that makes them less toxic has a problem. Okay. Now, on the last one has to be the reproductive system. Before, last but not least, the reproductive system. Now, most men are experiencing erectile dysfunction and premature ejaculation. This is a result of sugar intake. Why? You take in sugar, you destroy the liver, and therefore there is no production of testosterone. It is altered. Therefore, you'll have problems in erection. That's why the number one solution in fixing erectile dysfunction has to be sugar. Also, sugar has destroyed your kidneys, and another function of the kidneys is production of a hormone called EPO. This is basically erythropoietin. What is the function of this hormone erythropoietin? Its function is basically to go to the bone marrow and activate production of red blood cells. Okay. Now, remember, erection is as a result of flow of blood towards the penis. So, if you lack EPO, then you'll go into anemia. Okay. So, if you have anemia, then there's no blood flow to the penis. Then that means you will not have an erection, because erection is as a function of blood flow towards the penis. So you're having a problem with already sugar killing the liver. You're also having a problem with the kidneys, so no EPO, and that brings you more problems in erectile dysfunction. Now you'll go and take diabetic drugs thinking that you'll fix the problem. But diabetic drugs and hypertensive drugs will only fix the symptom and not the cause. The cause is what you're eating. I will repeat that until you get it. Now, so that is on reproductive system. Now on teeth, sugar destroys teeth. Sugar gives you the periodontal disease, the gum disease, because it attracts carbohydrates in your teeth crevices. And then these carbohydrates are food for bacteria, so they start a fermentation process, and then you change the pH of the mouth, and that lactic acid that is produced as a change of as fermentation process then starts to leach out enamel from your teeth. Once it leaches out, your teeth starts getting rotting, starts getting these problems of rotting. Also, the gums will start getting infection because there's high sugar and there's high bacteria turnover. Okay, so we also talked about nerves. So basically, those are the effects of sugar on these organ systems. So you can imagine how sugar is dangerous. You will have teeth problem, you'll have eye problem, you'll have brain and nerve problems. You will then have feet problems because of nerves. You will then have reproductive problems. In women, reproductive problems, you will have PCOS, you will have endometriosis, you will have uterine cancer and cysts. Now remember, cancer survives on sugar. Okay, so uterine cancer will survive on sugar, so it will get worse. Again, PCOS and all these endometriosis, these are conditions that are fed by estrogen. Where are we getting our estrogen? The channel is the same. You break down carbohydrates to get glucose. Glucose is converted to fat, and fat is highly estrogenic, so therefore estrogen hormone comes up. Once it comes up, then all those conditions that are hormonal imbalances and PCOS, endometriosis, and cancers and cysts start to ensue. So if you go to fix this and use those contraceptives that you're given as a cycle to help you replenish your hormonal imbalances, you will fail. Why? Because you've again not fixed the problem, you just fix the symptom. So if you want endometriosis to disappear, PCOS to disappear, and fertility to come back, the only thing you have to do is to fix your sugar. So your carbohydrate intake has to go as low as possible so that we fix the estrogen, because high estrogen levels in women are the problem. Once you fix estrogen, you fixed 70% of women problems. Okay, so those are the effects on different organs. So basically that's how sugar affects your system. And I want you to know this: there are so many drug combinations for diabetes, hypertension, cancer, obesity, and chronic conditions. So many drugs are coming out every single day, and so many drug combinations are coming out for diabetes. So much money is pumped into research for diabetes and sugar problems at the moment. However, diabetes cases are still on the rise. Our thought is, if you're pumping money in research and drugs that are supposed to cure this problem, then at the end of the day, these problems are supposed to disappear. Okay? So if they are not disappearing, then why are we pumping so much money in research and drugs? Why are all these drugs out? you start asking those questions and you get the answers. The answers are in your diet. So drug industries and business, they will give you all these combinations and they will tell you the advantages of this combination, but they'll never tell you the side effects of these drugs because it's business. Now you take these drugs and you'll still end up being amputated. You're taking your drugs faithfully, you still end up getting blindness and all these kidney problems and high blood pressure. So why don't you think that these drugs are not helping you? Because if you take these drugs, yes, they might help you recover. Drugs like insulin are life-saving. However, the solution in your diabetes and in your blood sugar and your problems is in dropping sugar. So that's how dangerous sugar is. Now remember on this chart we said we have micro and macrovascular. We talked about the microvascular. What about the macrovascular? This macrovascular is for large blood vessels like the aorta, the coronary arteries. So if you block these blood vessels that are bigger, that supply the heart, you get coronary heart disease. So this is where heart failure comes in. You're blocking blood vessels that supply nutrients and oxygen to the heart muscles. So you get coronary heart disease or congestive heart failure or even heart attack. So it comes as a result of consumption of sugar, not cholesterol. Number two, stroke. So basically stroke is the brain. So you are limiting blood supply towards the brain and therefore there is no supply of nutrients to the brain and its environs, and therefore the brain cells start to die. That is where stroke comes in. Then atherosclerosis, basically we just mentioned how this happens here. So those are the macro complications of sugar and the micro complications of sugar. Okay. So basically if you want to live a healthy life, then you will have to drop sugar by all means. Reduce simple carbohydrates in your diet as much as you can. What are these simple carbohydrates I'm talking about? I'm talking about honey. I'm talking about fruits. I'm talking about table sugar. I'm talking about the sugar that comes in ugali. You know, ugali, most of them tell me that ugali is very healthy and the portion meal ugali is healthy. I don't deny that. I'm telling you that ugali in the liver doesn't know you've taken ugali from the portion meal or ugali from a refined flour. The liver knows that this is sucrose, so this is glucose, and they'll handle it as fructose and glucose. So it breaks it down to give you either fat or glucose. Now that's the problem, because you think your liver knows what you know. It doesn't. The liver knows sucrose, the liver knows glucose, and the breakdown of this will go the side that the liver takes it. So be cautious when you're consuming sugar and simple carbohydrates. So that is the essence of it all.